The UGraft system comes in a portable, easy-to-carry suitcase. It comes pre-packaged with all components in the suitcase. It also comes with a 1-year warranty. Inside the suitcase, we will find the Dr.UGraft Revolution console. Then, we have the Dr.UGraft Nurture handpiece. Then, we have the Dr.UGraft foot pedal. Here is the power cord, which comes with 2 different power options. 110 volts for use in the Americas, and 220 volts suitable for European and other parts of the world. An instruction manual is also included, which fully instructs the operator on how to set up the system and do basic troubleshoots. This is how the Dr.UGraft system is delivered to the customer. Here are the components of the Dr.UGraft system. This is the Dr.UGraft Revolution console. It houses the computer system that operates the handpiece and the foot pedal. Next is the handpiece. It is a lightweight 3.5 gram handpiece made of titanium casing, and it comes with a cord that is permanently attached to it. The cord is not to be detached for any reason. They are to be autoclaved together as a single unit at the end of the procedure. Dr.UGraft Nurture handpiece is what runs the intelligent punch. It is also what receives the fluid tube through which it is to hydrate grafts during scoring, as well as to eject impacted grafts and debris. Next, we have the foot pedal, which has 2 pedals. The left pedal is the one that runs the Dr.UGraft Nurture handpiece. The right pedal is the one that operates the hands-free graft ejection fluid system, so impacted grafts can be removed quickly and safely without interrupting the flow of your procedure or sacrificing grafts. This is the power cord, which has the 110 volt adapter suitable for the Americas. We also have the 220 volt adapter, which can be used in Europe and other parts of the world that use this electrical grid system. As mentioned before, here's the user manual, which instructs on how to set up, operate, and troubleshoot the system. 3 consumables are needed to operate the Dr.UGraft system. Number 1 is the Physiologic Fluid Bag. It is the same type of bag that you would use to administer IV fluid, so it is off the shelf. There is nothing special about it. Second is the Dr.UGraft tubing system, which comes pre-packed and already sterilized in a sealed package. Check to ensure that the package is unbroken before opening it, otherwise it is not to be used. This tubing system connects the Physiologic Fluid Bag to the fluid port on the handpiece. It is specially made to work with the Dr.UGraft hair transplant system. Third is the Dr.UPunch I, also called the Intelligent Punch. It is an evolved flared hybrid punch. It is designed to intuitively correct punch malalignment, punch misangulation, and prevent torsion. It has a conical shape and intuitive depth control design. It is also optimized to work perfectly with the Dr.UGraft Nurture handpiece. These two working together as a pair would succeed in extracting intact grafts consistently in all hair types, all donor areas without exception. This is what it looks like when the Intelligent Punch is integrated into the handpiece. These are all the components of the Dr.UGraft Revolution hair transplant system. When you receive your Dr.UGraft hair transplant system, prior to using it, you need to sterilize 2 key components. The first one is the Dr.UGraft Nurture handpiece, which comes with a cord attached to it. The cord and handpiece are to be sterilized together as a single unit. They are not to be detached from each other. They are always to be maintained and used as a single unit in all circumstances. You would coil up the cord, make it portable, and then put it in a sterilization bag. You want it to be sealed as seen in this example. The whole unit, handpiece and cord, is placed in the autoclave machine. Next, you would need to sterilize the intelligent punch. This is the Dr.U Punch I, also called the intelligent punch, which works with the handpiece. This is what it looks like. It arrives unsterilized and must be sterilized before used. You can either sterilize it naked or by first placing it in a sterilization pouch of appropriate size. Then, place both the handpiece and the punch into the autoclave machine. For the autoclave settings, the preferred temperature is 134 to 135 degrees Celsius for a duration of 15 minutes. Alternatively, a color indicator on your sterilization pouch can be used to determine the temperature and time for the sterilization process. For example, this bag shows a pink arrow, which means not sterile. When the items inside the bag have been properly sterilized, that pink arrow would turn brown, as shown here. You can use whatever system your facility has for quality control to ensure that you are reaching the sterilization standards for temperature and time. Also, the system, both handpiece and punch, can be sterilized using ionized gas, which is also called plasma sterilization. These units, handpiece and punch, are suitable for that method of sterilization, and you can do that using established standardized protocols for those methods of sterilization. To assemble and set up the Dr.UGraft hair transplant system, you ideally need a table or a cabinet. A mobile cabinet would be preferable to set up the system. Start with the console. Then, the foot pedal. Connect it to the port on the right of the console. It goes into the bigger port. Place the foot pedal on the floor, close to where the operator's foot would be. Next, you will need to connect the handpiece, which you have already sterilized, so you'll need to take it out from the sterilization pouch. First, connect the handpiece cord to the port on the right-hand side of the console. There is only one port on the right-hand side of the console, which has a red dot on the 12 o'clock position. There is a red dot on the handpiece cord. Align it to the red dot on the console, and then push it in until it snaps. You can place the handpiece on the port to the left side of the console. Next, connect the power cord. Depending on your location, you would choose between two different options on the power cord. There is the 110 volt version, and you have the option to use the 220 volt adapter, which is suitable for European and South American countries. In this case, we'll use the 110 volt for our demonstration. Connect the console end of the power cord to the tiny port on the left-hand side of the console. Then, connect the wall end of the power cord to a power source. Next, assemble the fluid system. You would need the Physiologic Fluid Bag, which contains either Ringer's lactate or normal saline, and the Dr.UGraft fluid system, which comes already sterilized and prepackaged. Open the package, retrieve the fluid tubing system, and connect it to the bag. This is similar to what you would do when connecting an IV bag for administering IV fluid. It is no different. Close the tubing valve to avoid accidental spilling of the fluid. Next is connecting the fluid system to the console. With the operator facing the console, the bag should be on his left-hand side, the console in the middle, and the handpiece on the right side. This is so that the fluid would flow from the bag to the handpiece and not from the handpiece to the bag. With the physiologic fluid on your left, thread the largest part of the fluid through the fluid pump system located on the back of the console. You do so by unsnapping the pump hood to open it. Next, thread the larger part of the tube through the pump. Once it's in place, snap the pump hood closed to secure the tube in place. Next, connect the fluid tubing to the handpiece. In the midsection is a tunnel through which the tube is to pass through. Thread the tube through that tunnel and then push the opening into the port as shown here. The fluid system is now fully integrated to the handpiece. Next, connect the intelligent punch to the handpiece. The punch has been sterilized at this point by using your choice of sterilization method. Remove the punch from the sterilization bag and put it into the handpiece, as demonstrated on this example, by first pushing up the mobile collar at the end of the handpiece. Push it up to release the ball bearings, which hold the punch to the handpiece collet. Put the punch into the collet while pushing up the collar. It should snap in very easily. Then pull back the collar until you hear a click that indicates that the punch is in place. Congratulations, you are now ready to operate the Dr.UGraft hair transplant system. This is the foot pedal. The provider's foot should be placed in the center, in front of the foot pedal like so that the provider can move the foot to the left and to the right in an ergonomically friendly manner. The left foot pedal rotates or oscillates the punch in the handpiece. The right foot pedal flushes or ejects any impacted grafts or debris. The Dr.UGraft hair transplant system is optimized for ease of use. It has been made to simplify things for the operator. There are only 4 operation buttons on the console that you need to know. Number 1 is the power button at the bottom, which reads power. Number 2 is the button to the left-hand side, which revolves or oscillates the punch in the handpiece. It determines the speed and the mode of punch rotation on the handpiece. To the right hand at the top right corner is the Irrigation Power button. This switches on and off the fluid system that tracks to the handpiece. Below that is the irrigation fluid rate, which is symbolized by 3 droplets lined up one after the other. This is used to control the rate of steady flow of fluid that flows out of the punch to the scored area to hydrate and lubricate the grafts and punch tip. To operate the system, you begin by turning on the power by pressing the power button. Next, you would want to flush the system, which you would do by using foot pedal. Specifically, you would use the fluid pump pedal, which is the one on the right side. You would press it to eject fluid through the punch as shown here. It is very important to always do this before operating the system. Next, you would need to calibrate the system. The unit would need to be adjusted to the inclement temperature conditions in the handpiece and the environment. That is what the calibration is meant to do. You calibrate it by pressing the handpiece button on the top left-hand side. Press it multiple times until calibration mode is displayed, as shown here. Then, using your foot to operate the foot pedal, and pressing the portion of the pedal that operates the handpiece, which is located on the left side of the foot pedal, you would gently tap it just once and let go. When you activate the calibration using the foot pedal as in this example, the handpiece would start rotating, and you would notice the calibration bars increasing to 5 bars, indicating the end of the calibration process. At this point, the system would go back to the start mode, indicated by the appearance of a single bar, which is the slowest level of RPM in the system. The system is now ready for use. You should always begin at this low setting for all patients, for all skin types, for all donor areas. The system will intuitively prompt you until you find the right setting for the patient and for the donor area. Start with the lowest setting. This is the slowest setting of the punch. At this point, if this setting is appropriate for the skin type and thickness and the donor area, the punch will penetrate the skin to appropriate depth, execute its function with minimum effort, and isolate the graft. However, if the skin is too thick for the setting, the punch will fail to penetrate the skin adequately. When you notice difficulty on penetrating the skin, it means it's time to increase to the next speed setting. The system is indicating that the first setting is not powerful enough and is not the right setting for this patient's skin type, and particularly in the donor area you are trying to extract hair from. Go to the next setting at that point. The second speed setting is a little more powerful than the first one, and it's meant to penetrate slightly thicker and tougher skin. Then you should attempt to use the punch using this second setting. If it is the correct setting for that skin type and donor area, it should function effortlessly. But if it's not, it will not penetrate the skin adequately, and it would be time to proceed to the next speed setting, which is the third setting. You keep doing this until you find the right setting. The fourth setting, which is the one we are showing now, is the highest setting for the revolution mode. At this point, all skin types would be penetrated. You would succeed in penetrating even the toughest afro hair skin patients with the fourth setting. However, if using the fourth setting you are able to penetrate the skin but getting a lot of damaged grafts or transection, it is time to move to the fifth setting, which is the oscillation mode. The oscillation mode works for the toughest skin types. You would use the fifth setting typically on patients of African descent with very curly hair or very thick skin, on whom all other FUE systems would have failed. In the oscillation mode using the Dr.UGraft system, you would succeed in penetrating the skin of these types of patients and extracting the grafts with minimum transection. This setting is not ideal for body hair extraction. For body hair extraction, the first setting would suffice in all patients, with no exception. When the handpiece does not rotate smoothly, or altogether, it may indicate the need to adjust the strength of the handpiece rotation. Failure to rotate smoothly is when the handpiece stutters like this. To fix this, adjust the rotation strength by pressing the speed button on the left for 2 or 3 seconds. The strength settings would appear as shown. You can adjust the strength for both revolution and oscillation. Pressing the speed button will allow you to toggle between revolution and oscillation strength. Use the buttons on the right adjacent to the arrows to increase or decrease the strength value as shown. The strength range is from 0 to 30 for both rotation and oscillation strength. To get out of the settings mode, press and hold the speed button for 2 to 3 seconds again. Now it is time to break down the equipment and set it up for sterilization and cleaning. The first thing to do is disconnect the fluid bag. Dispose it. Next, you will have connected the tubing port to about 2 ounces of distilled water. This would be used to flush the handpiece. You will want to flush the handpiece and free it from any residue or debris as well as salt water. You place the bag end of the tube into the cup of distilled water as shown. Then, by pressing the right foot pedal, flush your 2 ounces of distilled water into a receptacle of choice as shown. You want to exhaust the entire 2 ounces of distilled water, which is what it would take to optimally flush and rinse the internal parts of the handpiece of the saltiness of the physiologic fluid. Salt has a corrosive effect on the internal parts of the handpiece. The use of distilled water helps flushing the salt water out of the system. It takes 2 ounces of water and probably just about 1 minute to accomplish this task. Next, you will disconnect the fluid tube from the handpiece, as well as from the console. By first unsnapping the pump hood at the back to free the tube. Remove the tube and discard it entirely. Next, you will disconnect the punch. You would do that by pushing up the collar of the handpiece, which frees the punch. Remove the punch and place it in a receptacle or discard. Next, you unplug the handpiece from the console. You do that by pulling the sleeve at the end of the cord backwards to free the bolts that hooks it to the console, after which you can simply pull the cord out of the console port. Now you would wipe down the console using any of the prescribed surgical disinfectant that are designed for this purpose. In this case, we are using Maxide wipes, a standard disinfectant designed for use in all surgical tools. Now it's set for the next use. Next, you would take the handpiece and cord unit to the sterilization room. Now that the handpiece is ready for sterilization, the first thing to do is clean it using detergent. Soak it gently, then scrub to get rid of any visible blood or debris. Next, using distilled water, you will rinse the handpiece. Once it's rinsed off, it is ready for placement into an appropriately sized sterilization pouch. Pack the whole unit, handpiece and cord together. Seal it all together as a single unit without disassembling them. Now that you have handpiece and cord unit in your sterilization pouch, it is time to be put on the autoclave machine. On the autoclave machine, you would set a suitable temperature. We recommend a minimum of 135 degrees Celsius or 273 degrees Fahrenheit for a duration of 15 minutes. However, you can also use whatever sterilization quality parameters you have as a standard on your area. You can also use the color indicator on the back of your sterilization pouch. Make sure that the indicator turns into the color that indicates the unit has been adequately sterilized. Also, this handpiece unit can be sterilized using ionized gas, also called plasma sterilization. The plasma sterilization is performed following the sterilization protocol standards that applies to your system.